Hi, everybody. This is Matt. Thanks for joining us today. I'm going to give everybody else just a little more time to log in, and we'll get started here in just a minute. Please let me know that you can hear me loud and clear by saying so in the questions tab, and we'll begin the presentation here shortly. Okay, we'll get started here today. Welcome, everyone. We are very excited to start off our monthly webinar series for 2019. This is an exciting time. A third of you are first-time visitors to a Provider Trust webinar, so we're so happy to see you guys here. And please sign up in advance. These are good for CEUs. Regarding your follow-up materials today, you will receive a replay of the webinar, a copy of the slides to disperse to whoever you see fit, and your CEUs will be coming in the next week or so. So stand by and be looking out for that email. And just want to say thanks again for joining. And we're so happy to do this and share this time with you guys. So today's presentation, 5 Steps to Success, Aligning HR and Compliance Strategy in 2019. And we have the perfect hosts to cover those topics today. Mike Rosen, our co-founder, a face you may recognize if this is not your first webinar. And if it is your first webinar, this is a face you'll come to know well. Mike has 25 plus years in the legal and risk side of compliance, and is just a great thought leader here at Provider Trust, and always has great things to share. On the other side is Donna Thiel, our Chief Compliance Officer. She has 30 plus years in the post-acute space and just brings a lot of knowledge regarding compliance, and it has a lot of great things to share with you guys today. So that's a little bit about our hosts. A little bit about us. This presentation is coming to you from Nashville, Tennessee, where we have been for almost 10 years. We love it here. We like to think of it as the healthcare capital of the world, at least the South. We have a lot of great companies here and work with a lot of partners in Tennessee. So that's a little bit about where we're from, and this is a little bit about what we do. We're focused on ongoing healthcare license, certification, sanction, and exclusion monitoring. We really like to say that we provide freedom from process to focus on people. So our software solutions help you guys solve some of those complex problems and monitoring for licenses, certifications, sanctions, and exclusions. And we love the compliance space and love to make tools that make compliance and HR easier. So with that, I want to find out a little bit about who we have on the call. So if you could just tell me, in which department do you work? And throughout these polls, if you do choose other, please add in the questions tab what department that may be, or whichever answer that is for the upcoming polls. We're just always curious of who may be in the other category. So I'll give you guys a little bit of time here to submit, then we'll close and share. Okay, great. Thanks everybody for answering the first poll. Something that we see is majority compliance officers, but we love to see, well, of course we love to see our compliance folks on these, but our HR people too. We're starting to have more and more HR functions join these webinars as we really focus on HR functions and how compliance and HR works well together. So Thanks everybody for being here, and I will go ahead and show you a little bit of today's agenda. We're going to cover your people are your organization, the importance of the people in your organization, and how they work together, how HR and compliance can collaborate and work well together, a little bit about where those functions may overlap, and the shared risk associated with HR and compliance processes, and then we'll bring it home with our 5 steps to success and how you guys can really make the relationship work effectively and efficiently. So with that, we will start with Mike Rosen.
Thank you, Matt. Matt does a great job here at Provider Trust helping us identify people that we think might be of interest to learn and share, as well as to keep those who are regulars in attendance, and we're really appreciative of all the work that he's done to get you here today. For those of you who are anywhere in North America, you're probably freezing. Nashville, it actually snowed this morning, about maybe 1/4 of an inch, which means some of our schools closed pretty quickly because we're not prepared for that, but it's really, thankfully, not as bad as it is elsewhere, and you're in our thoughts and prayers if you're anywhere north of the Mason-Dixon line these days. All right, so it's important that we really kind of maybe put a focus on what we're going to talk about today and why it is so crucial, in our opinion, that HR and compliance really work together and collaborate. Unfortunately, what we see sometimes in talking with the clients and prospects is still some siloing in the organizational structure of larger organizations, and yet we also have really eager people on the smaller side of organizations or the single provider hospitals, nursing homes, et cetera, in which they can kind of chart their own course. Wherever you fall in that spectrum, we hope that you'll have some tidbits to take back and challenge yourself, as well as maybe become the champion in your organization for some change that might bring about more collaboration, because it's really important when it comes to risk that, in particular, compliance and HR are aligned. So it's probably helpful, and maybe for some of you, you know this, but those of you who may be new to healthcare, sort of the evolution of where healthcare has become in our economy. You know, just in 2000, there were actually 7 million more workers in manufacturing than healthcare, which I found really fascinating. And it didn't take long for that really to change, even since the recession. That has in the early or the mid 2000s, that has increased more on the healthcare side. When you get the most recent statistics, which is 2017, now healthcare, as far as employment, has surpassed both manufacturing and retail combined. And that means that there are probably close to 20 million people currently working in healthcare in some capacity. That's not even including vendors and suppliers, that's people providing care. It is projected that this will continue to grow, and by 2026, it'll become the largest major employment sector in our economy. Probably no surprise to you. Probably scares a lot of you on the HR side, because that's a lot of recruiting, and that's a lot of management and a lot of training. And schools are behind in producing nurses and doctors and dentists to get us there. So there's a lot of work that has to happen on multiple fronts for us to be able to be ready for this. But let's talk about where we are today and the importance really in delivering both quality and valuable care. Because when it comes to the regulators, the OIGs, the Department of Justice's review of your organization, it really boils down to simply the quality of care that's provided. Now, of course, everyone's trying to avoid fraud, waste, and abuse. That's not tolerated, and it results in billions of dollars, over $2 billion last year in recoveries back by the OIG in soliciting this. But when you step up a level, really it's important, we think, to look at healthcare in the fact that the industry itself involves helping patients, providing care to them, and managing the employee challenges that comes with doing that. That really HR and compliance have a dual role, and sometimes a very messy role depending on the actions of a provider. everybody has the good intent, right? When setting up these programs that you're going to hire the best, you're going to recruit the best, and your brand is going to stand for itself, and you're not going to have malpractice, or you're not going to have overbilling and prescription errors and all the other things that unfortunately happen. But they happen because you're managing people, and people make mistakes, and people sometimes have bad intent. And so we're going to talk today about really the confluence of these two, where patients, they have choices these days. They have the opportunity to pick through a plan multiple providers. They might even choose between competing hospitals in a same city. And there's certainly then a higher demand for provider transparency. You see that in pricing, you see that in quality, you see that in, if I need a knee replacement, I can pick the doctor that I think has the best price and the best reputation. So a lot of this is very transparent to the patient, which requires a lot of efficient systems. When you talk about, however, in the employee side of providing that care, whether they're licensed or they're not licensed, unfortunately, I think you would agree there's a lot of inefficiencies in the current systems and processes. There are old legacy systems that were not built to handle and track the kinds of things that the OIG and CMS is requiring of you. There are multiple systems when it comes to payroll, when it comes to scheduling, if it comes to HRIS platforms and IT systems, and all the multitude of systems that are inside your organization that have to work together to help your employees do their job, to track the quality of the job that they're doing, and to really help them not get burnt out, right, from the paperwork that's required, or the type of efficiencies that come with that. And so when you add the ever-increasing responsibilities that are placed upon your staff because of staff shortages, because of right sizing, because of all kinds of ways that companies are trying to make it in this world, you certainly have your hands full when it comes to managing those employees. And so we always like to try to tie both in this presentation the care, the patient, and the provider of that care being your employee. And that's where the two intersect. That's really where compliance and HR have dual functions, responsibilities, and should be collaborating. If you look at the patient population quickly, you can see that there are more than 36 million inpatient admissions at community hospitals in 2016. A lot of care in the rural communities is being provided. And it's cheaper than to do that than to have to put someone on an air ambulance or a helicopter, bring them into a major city. And a good portion of the population does live in the rural markets. There's more than 2.3 million skilled nursing Medicare covered stays in 2016 to the beneficiaries, which is only 4% of the Medicare beneficiaries that are covered under that. So we know there's patients that they're coming to your facilities and your operations, but that's only going to grow. In 2016, there were 74 million baby boomers, and there were 71 million millennials. I was really caught off by surprise by that. I think Don and I both were really thinking, if you take that, that's 150 million. That's almost half the population of the U.S. A little less than is either a baby boomer or a millennial. Needs care at different stages and different functions of what's going on in their life, but will, in some capacity, come into the healthcare system. And when they do, they're going to be presented and taken care of by your employees, which are both an asset and a liability. So your team, which is providing the care to your patient, could be also doing it negligently, or unfortunately, or hopefully not, committing malpractice, or performing outside the scope of their license or their skill, their training. It's your job in HR to make sure that the right people are brought in. It's compliance job to make sure that they're not being staffed in positions that they shouldn't because they don't have the proper licensure, for example. And so these are ways that HR and compliance really should be working together along on a daily basis. It costs a lot to recruit and train people. HR is nodding their head. They're saying, yeah, it does. Estimates say it's up to $10,000 per employee spent to get them there and to get them trained. And so if they just leave in 90 days because they're either not qualified or not satisfied or they don't believe in your culture, it's a lot of cost to replace them and a lot of money spent unnecessarily. You know, your brand and your reputation is what makes the reason that people go to your facility rather than the one down the street. If you have dialysis, if you're in the dialysis business and there's the major competitors, there's probably 3 or 4 providers in any town of size, and your patients and people in the plans have choices. So making sure that you know their background when you hire them and that they don't have a license that's lapsed or that they haven't exaggerated a skill set that they have and you can actually prove that they can do these things really affects your brand and which is an asset to you. And then finally, a lot of times you'll find, you know, when working well, this is good, and that is that your biggest referral network comes from your own staff. If a nurse is happy in his or her job, they're likely to refer to their friend that you should come work at this facility. That's great if they are who they say they are, and they're a good asset, and they're a good worker. It's not good if they're part of a gang or they're, you know, involved in fraud somewhere else, and they're trying to see whether you have the right things in place that would prevent that from happening. And if they don't, they'll start bringing their friends and in comes problems to your organization. So clearly you have a lot to do at your organization from the care and from the employee side, making sure that all of this is done in a compliant manner. And another reason that we want to, as a prelude, talk about the importance of working together. So I guess it's probably best to ask and give us an idea, how often does your compliance or do your compliance and HR departments meet? And we've given you some round choices, estimated, you know, timeframes. And we're really eager here. We've done this in past webinars. We're going to share with you what we found last year compared to where we are starting this year. But try to think if your departments ever meet, you know, so often or pretty good about this. Matt, why don't we close out this poll? All right. So I don't know if this surprises you, but over half of the people on this call, which is over 200 people, don't meet together. These two departments are siloed. They don't have the opportunity or take the time to work together. And I really want to focus on this group because I think you'll find that that's a missed opportunity and a gap that would be best in your compliance plan and program addressed differently. For those of you who meet on a monthly basis, obviously we think that's best practice, and we'd love to hear from you on why that maybe has been a good success, if you're willing to share. And quarterly, of course, is certainly better than not. But over half of the people here are not meeting. These two departments are doing really important key work that drives down the risk and up the opportunity for a quality organization. They're not talking to each other. If you want to, we can to compare that though to the last year we did a webinar similar to this topic. It was a little less, so about a little less than half, 45% of the compliance teams had no meetings with human resources. So whether this is a trend, whether it's just a matter of beginning of the year and an opportunity to look at it differently, it's kind of consistent, if you will, Donna, that about half the people here are not meeting together, and that's an opportunity for collaboration.
Awesome, thanks, Mike. So let's start talking about collaboration between our compliance folks and our HR. So as we look at collaboration, it clearly starts at the beginning. When you think about the people in your organization, typically during the hiring process, there are some background checks that have to be done. So again, thinking about collaboration between HR and compliance, think about your people from the beginning and through their employment. So collaboration begins making sure that we understand the state and the federal documentation requirements, right? What are those things that we have to do? Legal and compliance is probably helping the organization define those background checks. Then we're going to look at the licensing and certification requirements. So as you're bringing your folks on board, you're certainly going to want to make sure that you know internally what are those licensing and certification requirements. And then what kind of messaging does compliance want to share with your new hire folks, right? We're going to be working with HR, looking at the initial training and compliance messaging that we want to share with our folks. And then disseminating the employee handbook, the code of conduct. Again, HR and compliance are going to be working together to make sure that our messaging is not only consistent, but it's really the voice of the culture of the organization that we're sharing within both the code of conduct and the employee handbook. So I think we would all agree that collaboration really starts almost in the pre-hire process, making sure that we know what we're doing upon hire, and then as they're coming into our organization, making sure that we have a joint compliance messaging within our employee handbook and our code of conduct. So let's continue to kind of draw that picture of how important it is that HR and compliance are related. These are just some, I think, some obvious things that that we see in our day-to-day operations. So from a compliance perspective, that's my background, right? We think about the hotline calls that we get. I think any compliance professional would say to you that at any given day, 60, 70, even 80% of the calls that come into the compliance hotline are really HR related. So as we hand off those calls and monitor and investigate the calls, compliance and HR are instantly partnering to make sure that we are doing a good job of closing out those calls. We might have retaliation claims that someone says, hey, I called the hotline and then my boss was mean to me, or I'm being treated in a different fashion. Compliance would be potentially investigating that, but HR, of course, would be partnering with us. Whistleblowers, key TAM actions, we know that more often than not, those start with our employees. So making sure, again, that HR and compliance are working together to make sure as people have issues or concerns within our organization, we're making sure that we're really investigating and following through on those so that our folks feel like we're listening to them and they don't feel a need to become a whistleblower. Certainly things like failing to follow company standards, right? Anything that falls outside of policy, HR is going to be investigating. But what happens next, right? Compliance has to come behind it and make sure that we understand and are monitoring for compliance with all of our own company standards. We talked about the importance of training. Mike talked about the expense of recruitment and turnover in our organization. The training that we have, if our employees are turning over at a high rate, the training materials that we have and the information that we're disseminating becomes more and more important because we are not always in front of our employees as much as we'd like to be. Unlicensed practitioners, we know that upon hire, we're making sure we're validating those licenses. But then what happens if we find out that a license is expired or that we have a practitioner that doesn't have the right license? Compliance is going to come in and investigate that and potentially have some self-disclosure things that they have to deal with. Excluded individuals, same sort of scenario, right? HR may find out about it. Compliance is the one that's going to have to come in and do the paperwork and figure out what the investigation and self-reporting obligations might be. Another easy example is just investigation partnerships. Sometimes our compliance professionals have investigation skills that maybe perhaps the HR folks don't. So we're going to work together to strengthen that relationship. Yesterday or the day before, I was talking with a compliance professional, and she was sharing with me that they've actually brought in an HR person into their compliance department. They were previously in HR. They're now a member of the compliance department. They did some additional education for this person on how to have better investigation skills. But I thought that was really a great opportunity to enhance the compliance department by bringing in an HR professional, right? Because they know the how to deal with all of the employee sorts of scenarios. And then hiring the right people, right? We talked about that. We're going to talk about this particular item a little bit more in another slide, but really understanding in the hiring side, asking some really good questions. And we'll kind of save that, Matt, for another conversation and a little bit more deeper dive. So let's look at the 7 elements of a compliance, an effective compliance program. That's a conversation that we in compliance have all the time, right? Every conference we go to talks about the 7 elements of a compliance program. But do we really realize how many of these elements have an HR component? So I think the 7 elements could actually be of compliance and HR. So policies and procedures, we know we have to have policies. Well, who disseminates most of those policies? Oftentimes HR is the first team, if you will, that's putting them in their employee handbook and helping make sure that they're disseminated. The compliance officer, well, HR hires the compliance officer, so that's an easy check mark. Education and training. We know that our two teams collaborate all the time on what good education looks like. One of the things that we did in my organization is that we inserted a compliance message into every single education or training program that we had in our organization, just so that we could, try in every different fashion to insert just a tish of compliance into our training and education. Monitoring and auditing, I don't think there's any organization that doesn't have some component of HR in its audit program or its monitoring program. So I think certainly when we look at new hire compliance, did we make sure we did all the background checks? Did we make sure that the license was properly validated during the hiring process? I think could fall underneath our compliance monitoring and auditing. Reporting, enforcement, and discipline, both of those go right hand in hand, right? Making sure that the information is being reported up through HR and that there's proper enforcement and discipline on an ongoing basis when we have compliance violations. And then the last one, right, response and prevention. We talked about the volume of hotline calls that relate to HR. So I think, again, maybe oversimplified, but I think the 7 elements of compliance really fall under both HR and compliance opportunities.
Yeah, let me add, Donna, it's interesting. You don't see HR officer on one of the 7 elements, and I think that's because HR was there first. Everybody knows that you need to have an HR function. The question was, do you need a compliance officer? And I think for some organizations, until really the 90s, there really wasn't a compliance officer. And in fact, there was a debate with the American Bar Association, and the American Bar Association finally came out and said that, in fact, the compliance officer shouldn't be also the general counsel, because there's a conflict. It may be that they're finding out something as they're conducting their compliance investigations and audits that's in contravention to what the general counsel may have to do to defend the organization, and there's a conflict there. And so very definitively, your general counsel, your compliance officer really doesn't even need to report to your general counsel, but they certainly can't be the same anymore. And so I think it's interesting that having a compliance officer was a needed step in the 7 elements, and brings to the table the fact that compliance plays such an important role in the HR function.
Thanks, Mike. Excellent. So the next couple of slides and things that we're going to talk about really kind of, I think, highlight the necessity for HR and compliance to work together. This first example is a physician whose license was revoked in a particular state. And according to the USA Today article, Dr. Isaacs allegedly removed certain vital organs and did the wrong procedure. So he allegedly removed a healthy kidney when he was supposed to be doing a colon surgery. There's multiple examples of this. So if you are in HR and you see a physician that had a license in a previous state and now is in your state, you would be asking the question, why did this person move from, state 1 to state 2? During the enforcement conferences this year, the HCCA enforcement conference actually in October, so technically last year, the OIG was strongly encouraging that there's an expectation upon healthcare providers to be asking more difficult questions, not just accepting the fact that the person is licensed in the state in which you operate, really challenging us to be asking those questions prior to employment. So again, compliance is hearing that message from the OIG, but we're not really involved in the hiring practices. So really incumbent upon compliance professionals to be talking to their HR counterparts, and saying, hey guys, help us out. Let's make sure that our hiring practices are asking great questions. So let's look at another example. We know, again, the opioid crisis is always in the headlines of all of us. So here's a nurse practitioner who's prescribing unbelievable doses of opioids. She still has her license, even though it's been acknowledged of her overprescribing practices. So again, what are we doing? The OIG, yesterday, I guess it was CMS, Mike and I were at the managed care conference, and they were sharing with us that there's a new toolkit that's being provided to healthcare organizations so that we can look at prescribing practices ourselves to see if we have any overprescribers within our healthcare system. So again, compliance is hearing that message, but it's incumbent upon us to be working with other members within our organizations to see what kind of people do we have working for us. And then if we're finding out this information, what are we doing back with our HR partners to really manage the people within our organizations? This last example is something that's near and dear to us here in Tennessee. This is something that's just kind of been in the news just in the recent past. This particular physician is affiliated with multiple patient deaths related to overdoses. Tennessee revoked this particular physician's license. They were so concerned when they found out that this physician was now practicing in Indiana that the licensing board here in Tennessee actually reached out to the licensing board in Indiana. So one of the things I might highlight relative to license revocations that we see here at Provider Trust, the OIG exclusions, 43% of all of the OIG exclusions are related to license revocations. So when we think about that in the compliance world, right, we focus a lot on exclusions, but did you know that it takes almost 6 months for state action to actually get to the OIG? So if you're thinking about HR and the partnership between compliance and how all this information rolls up, think about the fact that if you're looking at your folks and their licenses and being revoked in a previous state, you bring that person on, you make the decision, well, hey, it's okay, they have a valid license in my state. You may find out 6 months down the road that the OIG has made the decision to exclude that person because of their license that was revoked in a previous state. So again, really thinking about who you're hiring, why you're hiring them, and then as they're going through their employment with you, should they be staying on in my company? So I think compliance and HR really thinking about how are they going to work together to monitor those things. So the next area, and this is kind of just going to wrap up this section. I won't go through all of this, but I think you can see on the left, these are kind of those core functions that HR typically does. On the right side, functions that compliance typically do. But then look here right in the middle, all that license monitoring, exclusions, the hotlines, just really thinking about how what we do in compliance and what our partners do in HR really on a day-to-day basis really demand collaboration. And I hope, as Mike said earlier, that when you come out after our webinar today, that you're motivated to really reach out to your partner and think about how we can collaborate better to make sure that we have the right people taking care of the patients in our organizations each and every day. So let's move on to another polling question. So our polling question for right now is, who owns that process for monitoring state licensing boards for sanctions? And when we say sanctions in this context, we mean those restrictions or those actions that are placed on a license based on some behavior of our licensed professional. So does HR do that? Does compliance, credentialing, legal? We didn't give you an other, but if there's an other, I can't think of what that might be, but feel free to put that in. So Matt's going to leave that open for just another second or two, and then let's see what you all say. Listen to me. I'm from Wisconsin, and I just said you all. They're wearing off on me, or they're rubbing off on me. So it looks like about 38% of you, a little bit more than a third, monitor that in HR. Another third, wow, it's pretty equal almost, isn't it? So HR, compliance, credentialing, you all share in that responsibility. And then those 2% that are other, super interested in what that might be. So please give us a shout out in the, as the question in the chat. Where do they put that?
The questions tab.
The questions tab, thank you. All right, so let's kind of shift gears a little bit, and Mike's going to talk about some more shared information and functions between our HR and compliance folks.
Absolutely. And since we're at the halfway mark, wanted to remind you that we are recording this session. We will send it to you along with the slides. We also will be obtaining from HCCA your continuing education credits. Unfortunately, they're closed yesterday, today, and possibly tomorrow because of the weather. For those that we were able to talk with yesterday at the Managed Care Conference in Orlando, they were giddy that they were in Orlando rather than in Minneapolis, where HCCA is based. So we were unable to get from them the certificate pre-webinar, but we should be getting it the first of next week. So just as a reminder. Okay, so we're talking now about information and function and the sharing of it. Really, Donna outlined earlier a really important piece, and that is, what is the message that matters at your organization? And how does that translate into your culture? So it's best and we've done a whole webinar on this topic if you ever want to go to our site and find it for reference, but it's best when it starts from the top. If your management, senior management, CEO, et cetera, is walking the walk and doing what is necessary to really convey the culture that you're trying to enforce, it makes your life a lot easier. Now, the messaging therefore matters. When HR and compliance really play an important role together in pointing out that you can't just rely on doing the right thing, that is certainly something that you hope all of your staff has, but to help compliance with the ability to come down the hall and see and be seen, but not being the cop. It's really advantageous if HR and compliance can co-author this. It shows the employees that compliance is a resource and not just the cop. Being consistent and fair in this will help your staff avoid becoming a whistleblower, hopefully. If they feel that you care and that there has been a consistent message and the culture really tries to do the right thing, they're more likely to come and report through a hotline or to one of your offices, HR or compliance, an issue that they see. If they feel completely ignored and they feel that nobody really cares, nothing changes around here, and the experience that they have is there's the words on paper and then there's what actually happens here, they're going to go to the federal authorities first and become a whistleblower. So the messaging really plays a key role throughout the whole life cycle of a applicant and employee. Your code of conduct and handbook also are important. It has to be, I don't know if you have sat down as two departments and compared to make sure you're saying the same thing. Whether or not your policies and your codes of conduct reflect what's happening with your handbook. Or are they different? That's a treasure trove for a plaintiff's lawyer. They're going to find loops and holes and try to go after any way that they can. Better to have thought these through together. Do you have one hotline or two? When Donna and I were talking about this, I didn't realize that companies really might have different ones for different purposes. And if so, who's really monitoring those? And is there an opportunity to track and notify HR and or compliance if it's an issue that affects both departments? And clearly being siloed isn't really the way to go forward and be efficient today. So when you talk about the people information that you may possess, where is it? When we talk to organizations, it's all over the place. It's on paper, it's on location, it's on a certain floor by the nursing supervisor. Maybe there's an HRIS platform. If you're part of a larger organization, you may on your own track information on site, or you may have the advantage that you have a corporate HR or compliance department that does that for you in the field. It's all over the place. But the problem is that it's all over the place. And you really need to know, in HR needs to be in possession or at least have access to some of the key components. I'll give you an example. When we are doing our exclusion monitoring, and we've done everything we can to identify a very common name that we find, John Smith, at a state Medicaid board. And there's No other information at the state, just there is a John Smith. They don't say if he's a podiatrist or a brain surgeon. They don't say if he's 20 or 50. They don't give you a date of birth, an address, but they have something. A lot of times, compliance looks at that and says, what do we do? Well, if you knock on the door of HR and you look at the personnel file, that's the information that's there, you may find an address on the application that was disclosed, or maybe through the background check, the Social Security number trace that you did showed an address that matches something at the state and is a clue that would help everyone solve that issue. You may actually possess information, but it's siloed and not being shared among the departments. So think about the processes that you have today, and are they being tracked, and are they available to both sides of the house there, HR and compliance? If you have multiple locations, are they centrally stored, or is the information contained at the facility? And what happens when an auditor shows up? If the auditor shows up at that location, maybe at least having the access to the file electronically can get by. But if they show up to corporate, they're not going to have a way to know what's sitting at your facility level. And so how do you prepare for that? People data is really important, and it must be accurate and updated. And these are things that predominantly HR is responsible for, but compliance is going to want to have access. Donna, why don't you walk us through an example where by not talking to each other, there's a gap that we saw this is an example we saw at one of our clients.
Excellent. Thanks, Mike. So keep in mind some of the things that we just talked about, the timing and how long it takes for information to move. And this is a real world example of a particular person. So think back, June of 2016, there was an allegation of theft of money from a patient. That's the triggering event. 12 months goes by. The licensing board has been investigating, looking into it, doing all the things that they need to do. They issue an administrative action against the person. The person at that point in time has the opportunity to appeal, provide additional information, right? That person chooses not to do that. They don't take any defense relative to these allegations. So 1 month later, the board then revokes the license. So it's taken a whole year to get through this original allegation before the board actually revokes the license. 7 months later, the OIG has taken the information that they received at some point between July of 2017, and in January, they use their authority and they they exclude this person based on the license revocation. Then at the same time, we know SAM.gov, right? They go and they follow the OIG, and so they add them to their database. Now, 5 months goes along, and the person moves. They change their name, they switch states, and they issue a new license, right? Then in June, that person is hired by a new organization. They're hired under a new name, they have a new license, and everything's just peachy fine. What would happen to your organization? If you knew, would you be able to find that? We were able to find that at Provider Trust and help our new client who just hired that person because of the historical exclusion. But I think it's really important, if you were hiring that person in June of 2018, what would you have found if you were looking just at that person's name and you didn't look at maiden names or previous names? So really important to know that this is the real world, right? Someone changes their name, they do move to a new state, and that person may very well have gotten their new license while the other one was under investigation. So it was really no harm, no foul to the new state. But this is the real world, and I think an important opportunity for us to think about HR and compliance and how your process works. So next polling question. What states do you check for disciplinary actions or sanctions? So this question is really getting us to, are you just checking the state in which you operate? So only in my state? Am I looking at my state and just the surrounding states? Do I check every state? Or do I really not have the ability, or I don't choose to monitor, if you will, or look for disciplinary actions or sanctions at all? We'll give you just another second. to check that out, and let's see what the answers look like. So Matt says, wow, awesome job, 74% of you. Monitoring all states, that is best practice. I hope that means all of you are our clients, and so we're helping you do that, because I know what a crazy task that is to check that. Let's just do one more quick polling question as long as we're on polling questions. How often do you check state licensing boards for disciplinary actions? I think that's the same question, Matt. I think we, oh, I guess not. It's often versus states. Sorry, my brain's a little slow today. How often do you check? So we asked you where, now we're saying how often. Sorry about that. So we do it upon hire, we do it monthly, we do it annually, or some other frequency. And as always, if you want to share your other, we would love to hear that. So apologize for my forgetfulness right there. All right, so what does what do our results look like? So some of you, upon hire, more than 50% of you, so monthly, that is awesome. And then a few of you do it once a year. And again, a few of you have some others. So that's really insightful, because I think, as we just talked about, really the proactive process, right, is to monitor that. So we're going to move into some shared risks and just talk briefly about some, oops, did I skip a slide? Sorry. How about 5 keys to employee monitoring? Even more important. So as we think about monitoring our folks, again, talking about collaboration between compliance and HR. So what's the most important, right? Where do we even begin to look at this? Well, understanding what the state and the federal requirements are would be a great place to start. And then in my little mind, I would say, let's then create a checklist. So from a compliance perspective, I'm thinking about how am I going to monitor to make sure we do that? So if we have a checklist that documents what all those things are, it's easy for compliance to come in and monitor to make sure that we're checking off all of those things and we're actually meeting those requirements as we're bringing folks into the organization. And then let's look at what's our ongoing monitoring going to feel like in our organization. We just asked you about the frequency of monitoring for sanctions and which states we're looking at. So figure that out together, right? What's your risk tolerance, I would say, within your organization, and what do we want that ongoing monitoring process to look like? And then let's define the who, the what, the where, the when, and the how, right? So now we know what it is that we're going to do, but who's going to do it? Is HR going to do it? Is compliance going to do it? Where are we going to store that information? How are we going to report that information? All of that is really important. And then the last one, of course, is to implement it and then communicate it, right? We can't just build the checklist. We actually have to monitor it, and we have to report on it, whether it's through our compliance committee, whether it's through a dashboard between HR and compliance, right? But let's really implement it, and then let's talk about it. So now let's talk a little bit about some shared risk areas that we have between HR and compliance. We have a couple of slides that are some examples of things that we've seen in our experience in supporting our clients. The first one is exclusions, right? We generally think about exclusion monitoring happening in the compliance department, but I will tell you, more and more times we see organizations that own exclusion monitoring in HR. So every organization does it a little bit different. Chris Redditch, one of our co-founders, has a kind of a story, or if you will, that he always shares, that when you've seen one healthcare company, you've seen one, because everybody does it a little bit differently. And I think that's true here. So when we have brought on, this is a particular example, we brought on a client who had been doing internal monitoring, meaning that they didn't have a partner, they were doing it in-house. And we found 14 exclusions right off the bat for them. 3 of them were OIG, 9 of them were states. So what that means is they had people within their organization that they thought were trusted employees who were really excluded. And so we know from a compliance perspective, that brings with it some potential self-disclosure liability and penalties from our friends at the OIG. We also identified 4 employees that were on the Social Security Death Master file. So what that means is it may be identity theft. It may be simply fat fingering when someone keyed in the Social Security number, but it does mean that we're reporting wages to the IRS inaccurately. So again, an HR, an operational compliance issue. The next one that we want to talk about highlights some licensure experience from an onboarding. Now, this was a little bit different of a situation. This is where a client actually asked us to help them look at licenses right on initially when they brought it in, because they just didn't really have confidence that their process that they had in place at that point in time was as good as they wanted it to be. And they were right. When they gave us this data, we went out and verified licenses and certificates. And right off the bat, we found over 600 people whose licenses we were not able to verify. Now, I will tell you, we have sophisticated algorithms and we have all sorts of matching things that we do that is very sophisticated, and yet we still, after all that, couldn't validate 641 licenses. So that would probably mean that they hadn't been monitoring those licenses appropriately up until that time. You'll see that there were over 160 expired licenses. We were able to actually identify 246 licenses that they had wrong in their system, but because of our data, we were able to help them correct the information and validate it. So again, just highlighting some of the challenges. The next two slides that I want to talk about are just maybe a little bit different focused. The OIG work plan is something that we as compliance professionals look at all the time. We know that the OIG updates their work plan on a monthly basis, but I think this highlights how important it is for we as compliance professionals to be sharing that information with other people within the organization and explicitly with our friends in HR. So in August of 2018, the OIG came out in their work plan and highlighted concerns about staffing levels in skilled nursing facilities. And they started talking about how concerned they were that they were going to make it an area of focus and encouraging CMS to take efforts to help improve accuracy. Then guess what? In November of 2018, CMS comes out and says, hey, we're going to change the way we survey certain long-term care nursing homes relative to staffing, and they're changing their process. So there's a lot of words on this slide, but basically the OIG said something, CMS came in behind it. So let's go to the next slide and just talk about what that means. So all of a sudden, the OIG work plan, compliance has some information. CMS then changes the regulatory process and creates a change such that now it's across the board, right? Compliance, HR, clinical, operations, we all have a stake in this new regulatory process. So we would be saying to our HR folks, hey, how are you helping ensure that we have sufficient competent staff working in our nursing facilities? Compliance has to make sure that they're credentialed to work in the center, right? So we're going to be monitoring those licenses and those exclusions. Operations and clinical has to make sure the facilities are really using the staff to ensure the patient needs are met. So again, starts in compliance with the OIG, but partnership with HR to really make sure that we have the right folks and sufficient staff to be caring for our patients. So Mike, I'm going to turn it over to you to wrap us up with those key success steps.
Okay, perfect. So we do want to remind you that we're open to address any questions. If you will put them in the questions box, Matt will let us know and we'll be able to address them live with your colleagues. And if you don't have one but think of one later, you'll get our contact information. You're welcome to ask. We'd be happy to try to answer it. We promised you 5 steps to success, and I think these probably kind of summarize them simply for you. One is collaboration is key, and so sharing of files between departments, the appropriate files to put departments. There are some that maybe are to be separated and not shared unless there is a legal reason to do so, and that you can choose to do on your delegation of records, but the ability to share them is key for both parties to be able to be informed. I think Donna and I hopefully pointed out to you some of the key things that need to be done on a pre-hire basis, and you need to make sure you're conducting so that when you do your monitoring, you're not finding out of something that you should have known before hiring. But that necessarily then talks about whether or not you're actually monitoring in number 3, and the various things that you have to monitor that might combine both the compliance and HR collaboration. Fourth, and really an site for everything is building your culture and making sure that you have well thought out, consistent, and continuous training and education. I think compliance can play a key role in helping HR with that. And sometimes vice versa, HR would be helping compliance make sure that there are certain things that are shared with the staff, since compliance has to make sure that training is sufficient to meet your effective compliance program and plan. And then lastly, and we've done an entire webinar just on this one topic, what are if you could come up with a dashboard, and maybe the best way to wrap it up is to the two groups meet together and say, hey, what if we came up with a dashboard that kept the two of us informed? What would be the 5 or 6 things we'd want to know? Is it staffing levels? Is it prescription errors? Is it all kinds of different things that might, at least from a dashboard level, give you a view and an opportunity to real-time dig down where needed? It might be a very interesting conversation icebreaker, and then lead to an ability for you to build that or find software that allows you to share those pieces. So in our opinion, those are the 5 steps you could take to help move this forward. We do want to answer any questions that you have. We have resources available to you that may help you on articles, blogs, and ebooks we've written. They're there for you, and you'll see that in what we send you. But at this point, let's open up. If there are any questions, we have about a minute and a half remaining, and happy to do so. Matt, any questions coming in?
No, it doesn't look like you're coming in.
Okay. Well, we want to give you back a few minutes of your day, and thank you for it. Hope this was helpful and might give you the opportunity to instigate some new conversation and collaborate. We would be happy to answer any questions. You can contact or follow us in any of these various ways. And we certainly hope for those of you who are new that you found this helpful, and that any of the upcoming webinars would be of interest. We'd love to have you attend those. Look for the follow-up from Matt, and then ultimately the continuing education certificate sometime next week when we get it from HCCA.
Thanks, Mike and Donna. Thanks so much for putting this together for us today. Everyone on the call, thank you for being here. You'll see a very short survey after the webinar. Please fill that out just so we know what's relevant and valuable to you, and we can continue to make sure you have a great hour with us on a monthly basis. So from all of us at Provider Trust, thanks again for joining, and we hope to see you next month.